Welcome to the village. Okay, now the party started.
Hey,
Where are you? I'm so lost without you.
Em is here. Hello, hello. Yeah, last time we were doing breast cancer awareness.
Yeah, I know. I was thinking about that. That was all the way in October. It's almost December. So this is important because what's kind of snuck up on us now. That's why I was really, we're supposed to talk about something fun today. Not that the flu isn't fun, but this Health Alert Network Health Advisory about this early elevated respiratory diseases, which you nicknamed.
I didn't really nickname it. It's the news nicknamed it, the triple.
It's the news. Oh, I thought that you thought of it. I was so proud of you.
No, I won't take credit for that. I know I'm creative, but not that creative.
You see my problem with the fact that the news created it? I thought you did, so it was acceptable. But the fact that the news created this name, it's like, okay, this happens every year, okay?
Yeah.
We completely forgot that it happens every year just because it didn't happen the past 2 years. The past 2 years, everyone was like, oh, no one's getting sick except with COVID. Yeah, that's because we're all wearing N95s everywhere. Like, you can't get rid of viruses. They're hiding away, waiting for their moment to come back. So RSV and flu are like, okay, I'm glad you guys are not being careful anymore because I really need bodies to invade. And in particular, I need children because children have notoriously always done badly with RSV and flu. They didn't do bad with COVID. Children with RSV and flu, especially babies, especially RSV. Anyway, so what's the nickname?
Triple-demic.
Triple-demic. All right.
So yeah.
Thank you, people.
Dr. M here is out in the front lines because she's a pediatrician. So she wanted to talk about the flu and RSV, how that's going around, and it's becoming a problem. I know that we've been seeing a lot of really sick RSV kids in our clinic in the last few weeks.
They're saying it's placing a strain on the healthcare system because, well, obviously prior to this, every cold and flu season, every back to school season would be kids get sick, they're together, they're sharing everything, including their germs. But now it's earlier and it's worse than previous because of the fact that people aren't being as careful, and that's fine, but it's also, we took a hit. The healthcare system took a hit, and there was a lot of resources were taken away from children's centers and such. And so now we don't have that. And so we have less resources in healthcare, period. We're understaffed too. So it's just worse. It's harder, and kids are getting sicker. All the kids who haven't gotten sick in the past couple of years as much are now getting sick. I mean, and it's not just RSV and flu, because remember, we have rhinovirus, enteroviruses. There's so many different types of wintertime cold viruses, but RSV is notorious for making kids sicker.
Yeah.
That's why we should talk about some prevention, early treatment, that sort of thing. So they're estimating that the burden of flu itself is going to be 8 to 13 million illnesses, hundreds of thousands of hospitalizations. So, I mean, you're seeing this with, I'm obviously adults too.
Yeah, and like you said, Dr. M, before COVID, RSV was very, very predominant in the wintertime. I remember even working in New York in the ER as a clerk when I was in college, I used to see a lot of RSV kids come into the ER during the wintertime. And so RSV has always been a thing, like you said, every winter. It's cold for some reason. Kids always get RSV just because, like you said, their immunity is not as strong, especially for babies, right? And so those are the kids that tend to get really sick, right, with RSV.
Yeah, you and I would get RSV and it just like a cold.
Right.
I know adults are getting a little sicker with RSV than they used to, but everyone has always gotten RSV. But yeah, babies notoriously get sicker because they haven't seen it before. Their immunity and their lung compliance, they tend to aspirate more of their upper respiratory secretion that goes into their lungs, and then they end up with lower respiratory tract infections, and it's harder for them to fight it because they're so small.
Because they're tiny. And then the flu, right? The flu has always been bad, even before COVID. I remember right before COVID, we had a really bad flu season where people were getting really sick with the flu. Adults can get really sick with the flu. Besides kids, I think adults have notoriously been more sick with the flu.
Yeah.
So like now that COVID is coming back, because we just had the holidays, we just had Thanksgiving and a lot of people were gathering. Today, like my hospital, the numbers of COVID hospitalizations did go up. So, we're going to, I think, start to see it again.
Yeah.
COVID go up, but then like you're on top of that, like RSV is already here and flu is here. So that's why the triple-demic.
Right. And we're going to keep seeing like every winter is going to be a triple-demic. It's now not just RSV, cold and flu season. It's COVID and flu season. And it sucks because COVID, it's harsh. With kids, thankfully, not as bad, but RSV continues to be. I mean, we've seen kids, we've had to admit kids to our hospital. They've been on oxygen. Little babies under a month old have a really hard time decreasing their oxygen need, and that little bit of oxygen keeps them there for days and days and days, and their tiny little bodies are breathing so hard.
Yeah.
But I think just realizing too, just that there are so many viruses and none of them are new. These have been happening all the time. I think people have made it their business to just name names now. It's like RSV is not a new name. None of these things are a new name. This is the fact. We just have to be careful. And there's only so careful you can be. I don't want to make people think that there's something that you've missed if you end up getting sick. These viruses are sneaky little buggers. I mean, they do what they need to do. You can't see them, and just do the best you can do. There's only so much you can do.
Yeah.
There's things like if you are sick, try not to go out in public if you don't need to. If you do need to, try to wear a mask. Like just wear a mask so you don't spread it.
Yeah.
I think those are the responsible things to do as a member in society. If your kid is sick, if you're sick, just try not to spread it.
Yeah, and I think we've been talking about this during our lives, right? Like, especially when COVID was at its peak, we've been talking about prevention and preventing the spread. And, obviously with the mask mandates going away in the summertime, I think that's probably where all of this started, is like people started to just congregate and gather together inside. And like you said, you really cannot get away. And it's hard, except just being responsible. But so the question is, like, what are you telling your parents, like, especially now during the holiday season?
Oh, Jan. Oh, she's an RT. So that would be really helpful.
Oh, okay. I was like, I don't know who that is.
Let's have her on for a little bit because she can shed some light here. Jan?
Yes, hi.
Well, Mary, you're on our live video now. So Jan is a respiratory therapist. Mary is a physician. I went to medical school with her, and she's one of my close friends. She worked through the pandemic in New York City. And Jan is a respiratory therapist.
Retired,
so you're missing this fun time, but you can shed some light with us. We're talking about this, was it triple-demic?
Triple-demic.
And the difficulties we see with kids, with adults too. Mary does family medicine. What were you saying? We were talking about prevention and what people...
I was asking you, like, what are you telling your parents during this holiday season? Like, what's the advice that you're giving them, right? Especially with all this talk about the triple-demic and so many kids coming in with cold symptoms.
What are you telling them as far as how to behave, as far as do you see family members or not? That type of thing.
Yeah. See, that is a tough one, because if somebody's having symptoms, even prior to the pandemic, it was always a good idea to try to stay away from people if you were sick. Now, I say definitely if it's COVID and flu, you don't want to be around anybody, because COVID is airborne, flu is mainly droplet. Now, something like RSV or a mild cold, there's always going to be someone either who's about to get a cold, who has a cold, or is recovering from a cold. That's just the winter season. So say if it's not COVID or flu, And if you don't have any elderly or little babies around and you have like basically healthy people, a kid is sick or someone is sick, do what we did before the pandemic. Just kind of keep your distance, wash your hands, sneeze in your arm and wash your hands. Because RSV is droplet to an extent, it's mainly contact. So it is RSV and other cold viruses, which are not flu and COVID, and are not necessarily as deadly. You can avoid it if you're in the same room as a person. You can be in the same room, but maybe wear a mask or keep your distance. If someone's sick, wash your hands a lot. Because before the pandemic, I was sick. My nurses were sick. We were always sick and we're always being around each other. I would just like not sit next to that person, not use the same phone as them, not give them a hug. Remember back when we used to hug our coworkers?
Yeah.
Just be a little more careful, just like we used to. You don't have to wear an N95 for a regular cold. You don't have to avoid being in a room with someone. So I say if everyone is relatively got a good immune system, if it's not a little baby and if it's not an elderly person or someone with a chronic illness and you're trying to have a holiday function and you don't want to cancel that whole thing because someone has a little cold, that never used to happen before.
Right.
So just wash your hands, keep sanitizer, and if you want to be extra careful, throw a mask on that person. Like just a regular mask. That's what I say. Depends on what virus it is. They're not all the same. But of course, with little babies, they're worse, you know. So be careful for them.
We have a new baby in the family, 2 weeks old, a little girl. My granddaughter. Yeah.
Yeah, so definitely want to be careful with her.
The parents are being very careful, which I'm really glad about. The RSV scare recently and everything. They're still letting the grandparents see the baby with a mask on, and others, you know, who want to meet her very cautiously, though. And I think that's a smart idea, don't you?
People should wear a mask. Like I would say, even avoid if people can wait until she's a month old.
A month old, okay.
If she's a month old, because prior to a month, you've seen our little babies with those lungs just cannot handle it.
Are you seeing a lot of the RSV in your office?
Oh yeah, we're seeing a lot in the office, and we're seeing a lot in the hospital.
Sure. Yeah.
And pediatric hospitals are packed, but even the community hospitals, we do what we can.
Right.
Yeah, everyone's going down with RSV and flu lately. It's constant. And other viruses, if those are negative, it's another virus. There's many different viruses. So
sure.
That's what I've been saying. I mean, besides that, like let's discuss like other preventative measures, or what are you going to do to help prevent getting sick? Like what else? Like what do you tell your patients?
And I think that's the question that is really difficult to answer because, now, like, especially with Christmas coming up, like even my hospital, they canceled the Christmas party because COVID numbers are going up. So I think the main concern is still COVID, right? I think that's predominantly what we're still seeing a lot of, especially like in the last 2 days, like since Thanksgiving.
Oh, wow. Already.
Yeah, like the numbers went up today. And I think that's because, Thursday happened, right? So it's really difficult because people are tired of it. Like people are really tired of getting things canceled. And they, want to be told that they shouldn't gather in groups. What we're really telling everyone is just to make informed decisions and just to be careful. If you're going to have a party, make sure that you test at home before you go. Make sure you don't have COVID. And if you're feeling sick, just even a little tiny bit, and if you think it's allergies or whatever it is that you think it is, you should still test, right? And we've always been saying that this whole time. That even the tiniest like symptom of a runny nose or feeling congested, you should still make sure you test before you go anywhere.
Yeah, we're definitely not out of the woods.
And I don't think we ever will particularly be out of the woods, right, Jan? I mean, like COVID is every season, but we're going to see more when we're going to have like big holidays and things like that. It's going to make little jumps.
The surges, yes. for sure.
Yeah, people should never assume they have allergies. Last time I saw Mary, the other doctor I'm here, I had told you, like, felt like one of my tonsils was inflamed, but I was almost certain it was a tonsil stone like I get sometimes. But I wanted to let you know what was going on. We both tested ourselves for COVID and we're both negative, and so we proceeded to hang out. And so I think it's the responsible thing to do.
Yeah.
You don't want to be the reason that you get somebody sick or spread
Sure.
it to other people, because I think just thinking about the bigger picture and following the guidelines so you don't spread it. I mean, think about what goes around comes around, right? If you spread COVID to someone could spread something to you. Like, just think about these things. Like, just do the right thing.
Exactly.
Just you can get tested places you can get tested for other viruses too, but the big ones are flu, RSV, COVID. The reason I say RSV is because we have to remember the babies with RSV, because their lungs just can't take it, even if they're not sure, even if they're healthy previously. They're still a baby, and we've seen too many babies on vents and on CPAPs and just breathing in so much distress for days and days. It's horrible to see a tiny baby breathe like that.
Right. And being nose breathers like that, they're at risk more, basically, of suffocation, when you think about it. It's a suffocation kind of thing. My sister recently had it. She's over 60 years old, and she was very sick with RSV. So you just think about how bad it is for the tiny babies.
It's crazy to see how RSV is making older people so sick now, too.
Yeah, I understand I'm kind of out of the loop a little bit being retired now, but there's adults that are on ventilators. All over the country, right?
And it's also interesting because I think now, because we're seeing a lot more babies getting it and being hospitalized with RSV, actually RSV was here during the January surge. We had a COVID, actually. I saw a lot of older patients with RSV pneumonia in January. So nobody was talking about it.
Yeah, nobody was talking about it.
Nobody was talking about COVID.
Yeah, one of my nurses got RSV and she felt just as bad as she did with COVID. So I kind of got a whiff of it, but I didn't realize ventilators, and that's a big deal. Came back like with a vengeance. And just for ourselves too, just avoiding, like, don't touch your eyes, nose, and mouth. I always say that because these viruses can enter your body through mucous membranes. So really trying to wash your hands and hand sanitize. But then if you're in between washings and you don't realize, and you rub your eyes or you put something in your mouth and pop something in your mouth, that's a risk for getting it.
Yeah.
So those kind of things, gas stations, just disinfecting your phone, right? Like when you come home, wipe down your phone from, you've been touching it all day. It's basically dirtier than your hands.
Right.
And I
basically
think
going back to the old way of just using hand sanitizer and good hand washing and being extra vigilant.
I think that we weren't doing that. We were being lax about it, like in the summer
for a while.
For a while. I think that, and that's part of the reason why we're seeing a lot of this now, right?
Yeah.
People were like, "Oh yeah, mask off."
Right.
We don't need to wash our hands.
Right. Just because your mask is off, it doesn't mean you don't need to wash your hands. And wash your hands for a good amount of time so that it's effective. I actually was in Chicago recently, and I went to a restaurant with my sister, and I went to the bathroom to wash my hands, and there was actually a sign on there that it said, like, basically read this information while you're washing your hands, and by the time you're done, you would have washed your hands for the 20 seconds. So it kind of entertained you in the meantime. I was like, well, that's kind of nice. We should just have some sort of entertainment to help us. The other I wanted to mention, because I think there's this thing about Synagis. People talk about Synagis, and there may be some misunderstandings, right? Because it's not a vaccine, it's an antibody. like there's guidelines for babies who are eligible for it. So a doctor can't determine that, nor can a parent. It's already predetermined by the American Academy of Pediatrics. So either the baby must get it or the baby cannot get it. There's really no like in between. There's guidelines and they change a little bit every year. So, because I think like pharmaceutical commercials and things, they kind of put medicines and drugs out there and kind of tell the public that here's options. Like these options are not always something that's an option for you. And not everything's a cure-all or a prevent-all. Synagis is specific for RSV, but for specific babies.
Yeah.
Well, that's good to know.
Why do people harp on RSV? I think we're talking about it a little bit more, but I think people also, like I've noticed students of mine too. I think you ladies probably notice this too with people, even healthcare industry people. There's like an interchange between RSV and bronchiolitis, and they're not the same thing, right?
Yeah.
Like RSV is one of the many viruses, and bronchiolitis is one of the many disease states. And RSV can cause bronchiolitis, but many other things can cause bronchiolitis, and RSV can cause many things, right?
Sure.
Yeah. So I think that's just important to know, because sometimes parents will come to me too and they'll say, I just want to make sure it's not RSV. And I tell them, it's good to know, but what matters more is how your baby looks right now. So if it's not RSV and they look like they're struggling to breathe, that's the issue. Or if it is RSV and they look totally fine, then it's fine.
But I think it's also important to recognize and let people know that, you know, if you are sick, it's not always going to be RSV, COVID, or flu, right? Like you said earlier, there's many different types of viruses that can cause cold symptoms. And I think that's what we're getting a lot of now in the clinics, like urgent care, is people coming in and saying, I need to make sure this is not RSV or the flu. But then when we tell them it's negative, they're like, well, then why am I feeling this way? Right. So it's also very important to recognize that this time of the year, people are getting sick with viruses. Right. And I know that we're talking about RSV, flu, and COVID only, but this still exists. Your rhinoviruses, the coronavirus that wasn't COVID-19.
Yeah,
right?
Exactly.
So I kind of always had to have that talk with people, like especially in urgent care, because then they get really upset when then they're like, oh, well, it's not the flu or COVID. Well, you should be happy.
Right.
Yeah.
Right. I'm like, this is why you came here, because you wanted to make sure you didn't have neither of those, and you don't.
Right.
Yeah. Because both of those are going to make you feel awful for a long time.
Right. So I'm like, this is good. Whatever you have is better.
Whatever you have is better than COVID or flu.
It's important to also just let people know if you have the flu, like I'm seeing a lot of influenza A in urgent care, right? You can get Tamiflu within 72 hours of symptoms. So we still have medication for that. You know, you're talking about RSV medications. We have all the medications we've always had for flu. So this is nothing new. And I think it's important to also recognize you can feel better faster if we get you in and we know that you have the flu, we can prescribe you Tamiflu.
And that's why, yes, it's important to get in as soon as you feel sick, because Tamiflu works best within, like, the sooner you use it. If you're very sick or in the hospital, they'll still give it to you because it can help, but it may not help as well as if you catch it right away.
Right.
That was always the standard, right? If anyone was admitted to the hospital with flu, they'll get Tamiflu. Like, both of you have seen that.
Yes.
Yeah.
Yes, for sure. Girls, I have to sign off. I'm expecting a call from my sister.
Well, thanks for chiming in. Good to see you. We'll talk again soon.
Good to talk to you.
Bye.
All right. Bye-bye.
Bye. So
So I think, what is your ultimate message to people about this triple-demic and how we should handle it? Or maybe there isn't really one answer that we can give to people, but maybe just reassurance that it's here, it exists. COVID is still here. It's not going away, like you said. I think every year we're going to have COVID. especially during the winter time, like on the East Coast, like where we are, anywhere where it's cold, like it's going to happen. Flu always exists, no matter what, no matter the weather, no matter the time, you could still get the flu.
It's always there. Right.
Always there. And I think that this whole like triple-demic thing that people are in the news are kind of like spreading like this.
Yeah.
We know that this exists. We've been there as healthcare providers. We see it all the time this time of the year. And so it's still very important. The message still stays the same. You have to be careful. You have to wash your hands, keep your distance, and also get vaccinated, right? So I'm seeing people who are sick, and then you're like, okay, well, do you want to get your flu shot? Because there's really no contraindications to get a flu shot. Even if you're feeling a little sick, you can still get it. But people say no, and they don't want to get vaccinated for the flu for some reason.
That's the issue, that because people think, well, I get sick after the flu shot. It's the same thing as COVID vaccine. It's just your immune system working and trying to build the cells that are going to be needed if you do get exposed to the flu. So if you've had the flu many times in your life, you may not feel sick after the flu shot. But if you haven't had it as much, you will feel that inflammatory response. So they're already saying that this year's flu vaccine is going to have good coverage. It is very much similar to the previous years of flu. So this past year of flu should be covered pretty well in this year's flu vaccine. So it is a good idea to get the flu vaccine because these are viruses. There's no antibiotics for viruses. There's antivirals, but there's no antiviral for RSV. There's Tamiflu for flu, but it's limited. It's not a miracle drug. It doesn't erase the virus. It can kind of help you feel better faster, maybe. And there's COVID. There's some antivirals, but not everybody is eligible for those. So, and not everybody has access. And it's the best thing you can do for viruses, the best thing we have, the best medical technology is vaccines. Because if you're going to get a vaccine and if you end up not getting the vaccine, but then you get sick and then you're desperately wanting an antiviral, I mean, those things, I would much rather have a vaccine in me than get an antiviral later to feel better than feeling the sick I feel. Like, I'd rather prevent feeling sick at all, or even the same thing with flu, as we were saying for COVID, is you could still get the flu, but you will get a milder case of the flu potentially. Yeah. So you won't feel as bad, because remember, the flu, you feel significantly sicker with the flu than you do with other cold viruses. Yeah. Body aches, fatigue for weeks, headaches. The flu can be a systemic disease. People can have neurological symptoms with the flu. So the flu is not just a cute little
well, cold. Like, how I see it, though, is that, like, we have to remember that the other epidemic that existed before COVID was the Spanish flu, right? In 1922. Right. Pandemic, sorry.
It was a pandemic.
Yeah, 1920, 1822, something like that. But
in the war,
it was an influenza pandemic, and so people got sick and died. Let's not underestimate that the flu can really make you sick, just like COVID, and you could die from the flu. So that's why vaccination is very important, and this is where we're going with COVID, probably with yearly vaccinations.
Get the COVID and flu vaccine together now, the CDC says. And actually, the flu can also cause, like we said, pneumonia and death, like you said, including, and this is the sad thing that really gets me, because my emotional pediatric heart, children die every year with the flu, and they don't have to even be children with underlying illnesses. Yeah. Children do die. Children died with COVID too, but they've always, every year we've had people, but including children, get just as sick and die with the flu. We have to take the flu seriously. And like I said, it's droplets, so coughing, sneezing, even talking with the flu, it's pretty contagious that way. Yeah. It's not as contagious for as long, so it's not like the 14-day and the 10-day. It's like 7 days after you're sick, you can give it to other people. So But you can be asymptomatic and spread it too. So you may not even know you have the flu. You may think you have allergies and you're giving people the flu. So just be careful. There is testing, there's nasal swabs for all of these viruses. So getting tested is fairly easy.
I remember when it was like testing for the flu was like the thing to do. The initial swab, the OG swab for your nose was actually the flu. Okay. So don't get it twisted. The OG testing where you got to stick it up your nose was actually the flu. So
yeah, this stuff
you're not the first.
Been around. This stuff has always been around. This stuff is not new. It's not the apocalypse. We have been seeing this and dealing with this. We just don't think about what we don't see in front of us. So a lot of these cold viruses do look similar, although, like I said, COVID-19, I mean, that's the only one where you lose your taste and smell, I believe, right? My main thing here with this was to warn people about things they don't realize, remind them how to prevent, how to take care of themselves and their family, remind them about vaccines, and just clear up some misunderstandings too, about these different viruses. The other thing I guess I wanted to just kind of mention too, if you don't mind my little PEDC education piece. Yeah. The thing that, like, if your child does end up with one of these viruses and they are having a hard time at home, when to make that call. If they have a fever, they can have a fever. The fever itself isn't dangerous. It's the dehydration that is, that if they have a fever and they're not drinking, they're getting dehydrated.
Yeah.
Fevers are not as scary as they sound. They're actually the body's immune response. But definitely call. There's always a medical provider on call at whatever office you belong to. There's always going to be someone to speak to, so call them. You don't have to go to the ER urgent care immediately. You can ask. You can call someone and ask them first. Mm-hmm. So you don't have to take an unnecessary trip. But babies in particular, I just wanted to educate too, like if your baby has all this mucus, and basically it's mucus and dead tissue in the lungs that they're trying to battle to breathe through. So the best way is like pat your baby really hard, like move them around, jump them around in your lap, get them moving as much as you can get a baby moving. Because just like us, if you sit still, that mucus is going to collapse on itself and cause like these patches of debris and atelectasis, the airway kind of closing in on itself. That's going to make it even harder to breathe and longer time to recover and larger likelihood of them getting admitted to the hospital. So we want them moving. We want to get that mucus stuff out. Do the warm bath, do the steam, put the eucalyptus on them, do the baby vapor rubs, suction out the snot. They have that nose Frida. Where you can suction, like you're sucking it with your mouth like a straw and getting the boogers out. Some parents think it's gross, but some parents love it because they'll do anything to get the boogers out of their child so they can breathe better.
Yeah.
But if any doubt, call the medical provider's office. You can get them seen there and they will guide you. It's basically supportive care at that point. There's no antiviral for RSV or for most of the viruses. So just supportive care, getting them to drink, moving the mucus around, helping them to breathe better, suctioning it out.
How do you feel about humidifiers in the room?
Humidifiers are actually highly recommended because keeping a humidifier will help their airway be more moist so that things can be flowing as opposed to drying up and sitting in there with more difficulty. Some of these things, the American Academy of Pediatrics policies on bronchiolitis are not recommending, but we still do, like saline in the nose, saline in a nebulizer machine.
Yes.
Albuterol only works for some of the kids because it's not necessarily a bronchospasm, which albuterol is used for. It's debris and mucus. So steroids have never been needed in bronchiolitis, but in some cases they are given. So really, it depends. And if you compare notes with you and your friend, that your child may have gotten slightly different treatment because it really depends on what each child looks like and what their provider thinks they need. But it's going to be supportive care for the most part. Very little prescription usage, keeping the fevers down, acetaminophen.
Hydrating them.
Hydrating. Tylenol is good for even neonates, and ibuprofen can start at age 6 months. So yeah, keeping those fevers down, it's all supportive. It's probably going to be a rough season because we don't know if this is peaked yet or if it's just going to be a rough season for several months to come. So
yeah. I don't think it's peaked yet, right? Honestly, because Christmas is still coming.
Yeah, no, you're right. Christmas and New Year's, New Year's.
Yeah.
At least children are not around at New Year's as much. They're just like us crazy adults doing things.
And also, I feel like the winter hasn't really hit us yet, right? In New York, especially, we've been getting all this weird weather. So I feel like winter's going to be really long, Em. We're going to be in this season really deep.
Well, the problem with winter too is we're indoors, right? Less ventilation.
Right.
So viruses tend to spread more. So you're absolutely right. That's the hard part. Another thing I want to touch on, like, remember we were talking about allergies?
Yeah.
How do you know? I'm sure your patients tell you, I thought it was allergies, or is this allergies, or am I sick? Is it allergies, or are you sick? How can you tell?
Well, usually, like if you're an adult and you have allergies, you kind of know what time of the year you usually get these symptoms and what triggers your allergies, especially if you've had seasonal allergies for a while, or like some people have had it for years. They know how it feels like, right?
Mm-hmm.
But if it doesn't feel like your normal allergy symptoms, you feel like tired, or you might have like chills, body aches, like other things that you don't normally feel when you have allergies. I think that's what makes it different from like how you normally feel if you do have allergies.
Mm-hmm. And allergies will persist in kind of like a couple weeks or longer, just kind of persisting there.
Yeah, and then it's also someone who thinks it's just allergies, and then you're like, well, have you ever had allergies? And they'll be like, well, no, actually, I've never had allergies. And you're like, well, how do you know this is allergies? Right? So that's why I always kind of started off with that. Do you always get this? Is this something that happens to you every year? You know, as a person who gets allergies all the time, I've been getting allergies since I was like in my 20s. Like, I know what it feels like, and I know exactly when it triggers. So if I'm feeling off, then I know that's not my allergies.
Mm-hmm.
Even if I'm still getting the runny nose and the congestion, because I tend to be more of a nasal person when I have allergies.
Yeah.
But I will know the difference, and that's when usually I'll test.
So yeah, there is a difference. You do kind of know. If you're feeling just really rather sick, you're probably sick.
Yeah. And allergies can make you feel sick. That's the thing. If you have really bad allergies, you can feel like you have a cold or you have flu-like symptoms, and that's why people get confused. So
Mm-hmm.
the answer to that is always, if you're not sure, then always just see your doctor and get.
Mm-hmm. They can look up your nose and kind of tell that way too. There's a really nice chart I saw on Medical News Today website that kind of compared for people to kind of get an idea, sick versus allergies. I don't know. But don't hold off and think it's allergies. Go and see a medical provider, right? What are some of the winter allergies?
Well, here, like in New York, what we see a lot is the people who have those old school heaters that are built in, and you have spray and it's collecting dust. So, I mean, the most common allergies that people have is to dust, like dust mites inside their home. So usually in the wintertime is when people who don't really have allergies during summer or spring, then they start to get the runny nose or the sneezing, itchy eyes, runny, like watery eyes. I always ask, where are you sleeping? Like, are you sleeping next to your heater? Right? What kind of heater do you have? So it's always like the ones that are built into these old apartments in New York City, especially the old homes that have those built-in heaters with the little vents, and people don't necessarily clean them because they're dusty. And then when you turn them on in the winter, it just blasts you in your face with all that dust that it's been collecting.
Mm-hmm.
So, usually it's just having to figure out and be like an investigator investigating what is it that could be causing this person's symptoms. And it's usually something in their surroundings, right? If it's allergies.
Yeah.
Here in the winter, that's what is the most common thing that I'm seeing as the heaters.
That makes sense. And just keeping things clean. You're not going to air out your home as much. So all that dust, just kind of cleaning up as much as possible.
And like you said, the windows aren't open, you're not ventilating, the air is dry. And so that's why I always tell people in the winter, use a humidifier.
Mm-hmm.
Like, no matter what, even if you don't have a child or even if you don't feel sick, it's always a good idea to have a humidifier in your room, if you have the heat on.
Yeah, it's going to get dry. You're going to get dried out, and it's for your sake too. because as adults, we have to get up and go to work and you want to feel well,
Well, and it's also, it's bad for your skin. Like if you have dry skin in the winter, like I do, the heat dehydrates your skin. So if you don't have a humidifier, you're waking up and you're like cement.
And we know that dryness ages you. Dryness causes wrinkles, so we need to keep our faces moist, keep yourself moist and healthy, and look fresh. And, we look so fresh and tan in the summer, and then we look so pale and dry in the winter.
You look cracked. You don't look dewy.
You don't look dewy fresh. Yeah, this is very important. I just wanted to point out about asthma real quick, too. I think asthmatics, children and adults, are prone to exacerbations. Everyone's different, but a lot of people are prone during the winter because they are indoors, there are the allergens, the cold weather itself, and then all these viruses. So for kids, some of the kids, I put them on a preventative steroid inhaler or nebulizer treatments just for the winter time because that's when they get worse. So you have to be compliant with those things if it's daily or twice daily because you don't want to get that inflammation and then try to decrease it. You just want to try to avoid it. Avoidance, prevention is the best for asthma.
Yeah.
You don't want your lungs to get sick and heal. You want to avoid them from getting sick.
Yeah. Or
prevent them from getting sick. Avoid them from getting sick.
I guess you can avoid and prevent.
Okay. And with the asthmatic, they will most likely end up on a steroid course if they get a bad exacerbation. And you don't want to give your body, especially if you're a child, too many systemic steroids.
All the time now.
Yeah, it's not good for your growth and development. And if you're asthmatic, please get the flu shot. You don't want to be an asthmatic with the flu. Your lungs do not like the flu if you're an asthmatic.
Any virus, right? Some kids get triggered by viral infections all the time.
Absolutely.
Yeah.
We've seen many kids with asthma and viral infections inpatient, and they can be healthy otherwise, but it's the asthma that triggers that bronchospasm and that hyperactivity of their airway. Let's be careful for our asthmatics too. I'm asthmatic. Maybe that's why I'm laughing.
Oh.
I have to say though, Em, I don't know. What's your theory for this? Okay, tell me this. When I was in residency in Westchester County, okay, but let me not do like a bias here. I want to tell you, I was in residency, therefore it was stressful. I lived in a small, not that great apartment because I was a resident. So I was always I ended up on Symbicort, which is for moderate persistent asthma. Because I was always coughing, always I'm not always short of breath per se, but the cough is terrible. Up here, thank God, I was living in a house as of recent, and I've been and attending. I mean, my job is stressful because all our jobs are stressful, but it's not residency.
Yeah.
And I've had maybe 1.5 exacerbations where I've needed to take a lot of albuterol, but for the most part, no, it's I don't have night cough, nothing like that. I'm like a mild intermittent asthmatic. Is it, and I'm here in upstate New York now. Is it the air or is it the life? Is it the situation? What is it?
It's probably both. I mean, you were probably living in a more congested area with a lot of more, pollution in the air.
Oh, my sister's here. She can attest to my asthma. She gets so worried about my asthma. I'm I'm basically fine now. And she's like, no, you're asthmatic. You can't get sick.
Well, and also because residencies are very stressful of your life. So, you were probably not sleeping, not eating well.
Right.
And you were always stressed. That's definitely a trigger.
I was so skinny my intern year. I bought these pants that I could never fit into again after that.
I did the opposite. I ate a lot.
I ate later. When I got more comfortable with residency, I ate more. And then I was gained too much weight. Then I had to go on a diet.
What is your sort of like overall message?
We talk about natural remedies first before we do the overall.
Okay, the natural remedies.
You know, I like to talk about natural remedies. If you are sick, extra vitamin C, zinc. I like eucalyptus and peppermint oils in the bath or directly on you or on your child if they are having fevers or coughing. In order to prevent allergies or illnesses, turmeric and natural raw honey. Turmeric is a very strong anti-inflammatory. There's been studies on how it actually helps with chronic systemic diseases.
Yeah, but remember, you can't give honey unless the baby's 12 months.
Actually, it's 2 years now, Em.
2 years.
Yeah, they changed it. Although there are some baby cough syrups with dark honey in there.
Yeah.
And if you are sick too, lots of hydration, because hydration gets rid of junk, whether it's mucus or helps you like urinate out the toxins. Just always drink water. Just do it.
Especially if you have a fever.
Yeah, because fever increases metabolism and you're going to lose more fluid. So you want to get that back. You want to get back your fluid by drinking water. And the humidifier is going to say, I'm glad you said it, and hot, warm showers, get rid of that mucus, and then drink water again because you're going to lose water that way too.
So yeah, I mean, vitamin C is always good. Said zinc. But yeah, it's always, my number one advice is always hydrate, drink lots and lots of fluids, replace your electrolytes. I always say ad lib, meaning as much as the kids can drink and as much as you can drink. Like sleep. Like sleeping is very important. Sleep is the number one thing. If you're not sleeping, your body's not resting and your immune system. And like, what do you say about all those like over-the-counter cough medicines? You know what you're talking about. Like now you can give honey at two. So, you know, when you can't give any medications per se.
Zarbee's products for babies, and they're just like very natural products. Otherwise, I say like the bath, the eucalyptus, peppermint, the saline in the nose, just supportive, pushing fluids, Pedialyte, keeping them hydrated, and then the natural ways to bring down fever. Peppermint brings down fever, cool washcloths bring down fever, lemon juice in the water or in the Pedialyte brings down fever. That's usually what I say. There's a bunch of things you can do.
Well, what is your wrap up? Like, what is your final?
The point of this was just because there's always a lot of hype. We are having our usual cold and flu season, but it is worse. It's going to be worse for many of the reasons we stated. We shouldn't go into panic mode, but we shouldn't go into whatever mode either. We need to be cautious. We need to do our due diligence and be responsible. And we need to talk to your medical providers because we have done this. We do know how to help you. Hi.
We do know how to help you.
With us. Because she works at a hospital, children's hospital. We're wrapping up with what our point is of having this triple-demic chat right now, why it's important to talk to people now. And my point was, we don't want to go into panic mode, but we don't want to go into whatever, it's fine either. We need to be still careful, responsible, do the things we have to do. Life doesn't have to stop, but we do have to be careful. And we should go to the experts, the medical providers, for guidance, because we've gone through cold and flu seasons every single year for like the past 2 decades. We know how to help you. It is a little different this year, and it is worse. We're not going to deny that it's worse, but the tools and the rules haven't changed.
The tools and the rules, I like that. I didn't think of the triple-demic, by the way.
Yeah, I thought you did. I was impressed. So that was my wrap up. That's my point. What about you ladies doing the things you do and seeing the things you see?
Well, I'm going to let Arshia talk. I've been talking for a whole hour.
Oh, you're so sweet. No, I agree. I mean, I agree with what you said. You don't have to put your life on hold for sure, but you should always use caution. You should always carry sort of, hand sanitizer with you. What I do is I still carry my mask, and if I go into a store that's overcrowded, then I'm going to put my mask on. Grocery stores, I definitely put my mask on, because people are still kind of going to be spreading all the other things, right? Just because we're not in COVID, they're going to be spreading flu. They're going to be spreading other viruses that are going to cause issues. So especially, I do work with kids who are immunocompromised. So I especially try to take caution because I don't want to come to work and spread anything here. So
Yeah,
you're right. It's something we should have probably always done. And COVID just highlighted it even more so. I don't think I'll ever take my mask off fully, honestly.
I agree. I don't think I will. And that's what we were saying too. This is getting hyped up because of COVID, but this has always been a thing. And people absolutely, especially, that's why I thought it's important you state something to people too, just doing what you do.
Yeah, especially you with asthma and all.
Yeah. And like, you don't eat when you're stressed.
And she doesn't eat when she's stressed. Mary and I apparently eat too much when we're stressed. But
I like that, Em. I like how you said use the tools and the rules.
The rules.
Right?
Yeah. They're still the same. We're still the same. We've been around the world trying to learn about these things.
Maybe that should be sort of your next episode. Just call it Tools and the Rules.
Yeah.
And go through all the tools and the rules.
That's a good idea. That'll be our next.
Hopefully I won't be on call and I can just be on.
Well, we've been wanting to do one with you anyway.
Yeah.
It was a nice surprise.
Yeah. Be safe. We're here for you.
All right. Well, it's been fun.
I'm seeing my own sister virtually. Yay. All right. Good night. Stay safe. Have a good holiday season.